Hi folks, welcome back to Nurse Nita again. Today I'm gonna talking about the most high yield topic that you always be tested on the NCLEX exam. Today I'm gonna talking about the angle closure glaucoma. If you want to pass your NCLEX exam at your first attempt, at any time that you take the NCLEX exam, you need to listen to this topic today. Do you know why NCLEX loves to tell you about angle closure glaucoma? That's because angle closure glaucoma is concerned as ocular emergency. Yes, ocular emergency. This is a key point that you need to remember because the NCLEX always concerned about patient safety. Anything that concern about medical emergency, ocular emergency is very important and is always concerned by the NCLEX and is always test you on the NCLEX exam. Why angle closure glaucoma is concerned as ocular emergency? That's because it can cause blindness to the patient. This is why NCLEX love to test you about this disease or this topic because blindness is one of the emergency situation that we need to concern, that we need to prevent. The key role of the nurse is to prevent the patient to not have the blindness, and the key role of the nurse like us is to help the patient to not have the severe complication of those disease. Angle closure glaucoma is an ocular emergency where the drainage angle between the iris and the cornea closes suddenly that prevent the aqueous humor outflow, and it can cause a rapid increase the intraocular pressure. So this increased ocular pressure can damage the optic nerve and the patient could be blind. This is why we concern that angle closure glaucoma is an ocular emergency because it can cause the blindness to the patient. So in with this disease or condition, the patient requires immediate treatment to prevent the blindness or reserve the vision. The causes and the risk factors of angle closure glaucoma include pupil dilation or mydriasis. This can trigger acute closure glaucoma. 2. Darkness. Pupil dilate in the dark and is made risk for the angle closure glaucoma as well. Stress activates the sympathetic system. Medication. Some medications like anticholinergics or decongestants or antihistamine could be a risk factor as well. And the demographics like female, old age could be the risk factors as well. The clinical symptoms of the angle closure glaucoma. This is a key point that you need to remember as well because NCLEX always focus about this. First, sudden eye pain. Usually it's severe in one eye. The patient complains about eye pain, severe eye pain. Blurred vision, may see halos around lights. Headache. The patient often complain about headache on the same side of the eye pain. Nausea, vomiting because of the increased intraocular pressure. Red eyes may seen as well with a mild dilated or fixed pupil. Firm eyeball to touch. This is a key point as well. Firm eyeball to touch is a hard glove on palpation. So this is a key point you need to remember about the clinical sudden eye pain, blurred vision, headache, nausea, vomiting, firm eyeball to touch, and red eye might be have it as well. The diagnosis is tonometry. We use tonometry to measure the intraocular pressure. So the intraocular pressure or more than 20 or over 40. The slit lamp exam, we see narrow or close angle. Gonioscopy to measure angle wide. Now we're talking about the NCLEX red flags. When the patient comes with the sudden eye pain, vision change like blur vision, nausea, vomiting, we need to concern about these signs and symptoms. We need to notify the healthcare provider immediately because this could be angle closure glaucoma and the patient could be blind if we delay treatment. This is the ocular emergency. You need to remember this ocular emergency. The priority is to reserve the vision or prevent the blindness to the patient. Now we're talking about treatment. The emergency prescription, the emergency medication that the patient could be prescribed, such as Timolol. Timolol is one of the beta blocker. Timolol eye drops are used to lower intraocular pressure. This is an emergency medication. This is the key point that you need to remember. The emergency medication that could be used in the angle closure glaucoma, Timolol. 2. Acetazolamide is a diuretic and is given by via intravascular or orally to the clients as well. This is to help manage the angle closure glaucoma to reduce the IOP or intraocular pressure, and the client should be placed on the supine position. This is the key point as well you need to remember for the NCLEX exam. The client should be placed on supine position that to assist the lens falling away from the iris and that can decrease the block of the pupil. Okay, these three things that you need to remember on the treatment on our nursing interventions. The patient may prescribe the emergency medication like Timolol and acetazolamide or the diuretic, and the patient should be placed on the supine position. Okay, the medication for acute management, we make it the conclusion again for the medication for acute management. The beta blocker or Timolol to reduce the aqueous humor production. Acetazolamide or diuretic to reduce aqueous humor productions. Alpha agonists like Pilocarpine to reduce the aqueous humor productions as well. Myotic Pilocarpine to constrict the pupil to open the angle, and mannitol IV or osmotic diuretic for the severe IOP, the severe increased intraocular pressure. Okay, so now we're gonna talking about the contraindicated medication that we need to avoid to use in the angle closure glaucoma. You need to remember this as well for the NCLEX exam. Why? Because the NCLEX exam concerns about patient safety and the way that you know that which medication that's contraindicated to the angle closure glaucoma is the way that the NCLEX want you to know. Okay? Contraindicated medications include anticholinergic drugs because it could cause the pupil dilation. Antihistamines because it can increase the intraocular pressures because the pupil is dilated. Decongestants It can cause sympathomimetic dilation, and it could increase the intraocular pressure. TCA or tricyclic antidepressants can cause the increased ocular pressures as well. Okay, so we'll see about the NCLEX scenario. The patient with glaucoma takes diphenhydramine or Benadryl. What we should think about this? Diphenhydramine is antihistamine, and it can cause acute angle closure crisis, which means that it can cause increased ocular pressure more and more. So the patient should stop this medication. The nurse should stop this medication and notify the doctor immediately. Okay, this is all about the angle closure glaucoma. That all we're talking today is a key point that you need to make yourself understanding and remember for your NCLEX exam. I'm gonna make the conclusion again for you. We're talking about what we need to know to take the test to pass the NCLEX exam at your first attempt or at any time you take it. We're gonna make a brief conclusion again about this topic. Okay, try to remember, try to make yourself understand about what I'm gonna say again about the angle closure glaucoma. Angle closure glaucoma is ocular emergency. It can cause blindness. The key priority of the treatment is to reserve vision, prevent blindness. Okay? The clinical symptoms that the NCLEX always focus on, because the NCLEX want you to know that if the patient come with these symptoms, these signs and symptoms, what you need to think about and what you need to act to save the patient. Okay, so the patient with angle closure glaucoma will come with sudden eye pain, blurred vision, nausea, headache, and firm eyeball to touch. Okay, and the treatment, the key treatment, the emergency prescription medication is Timolol, and the diuretic like acetazolamide. Okay, and the patient should be placed on supine position. Okay, this is the key point that you need to remember about the angle closure glaucoma, and you need to try to make yourself understand the key concept and understand the key point, remember the key point, and then you can apply for your test for your NCLEX exam, and you can pass your NCLEX exam for sure at the first attempt or anytime that you take it. Okay, now we're gonna talking about the example question on the NCLEX exam about the angle closure glaucoma. Question number 1. A client with a history of glaucoma presents with sudden eye pain, hair loss around eyes, and nausea. What is the priority nursing action? A. Administer an opioid for pain relief. B. Apply warm compress to the affected eye. C. Notify the provider immediately. D. Encourage the client to rest with eyes closed. You pick your choice and you see the answer later. Okay, question number 2. Which medication should the nurse question for a client with a history of narrow angle glaucoma? A. Lisinopril. B. Loratadine. C. Pilocarpine eye drops. D. Timolol ophthalmic solution. Okay, you choose your choice and you see the comment below for the answer. If you have any question, you can leave your comment below. I'll go to read and answer you. Hope you pass your NCLEX exam at your first attempt or anytime that you take it. Good luck. Bye.